everybody, this is Dr. Warren Kalkstein. I'm a chiropractor here in Towson, Maryland. I'm with Margarita today.
Hello.
And Margarita, you are expecting something very soon, aren't you?
Oh yes, little bundle of joy here.
And towards the end, maybe even more of that bundle of joy that you have to focus on, because some things start to shift around a little bit and you're starting to notice some aches and pains. And it's kind of what brought you to our office in the beginning. Backing up a little bit, chiropractor, but I also work a lot of pre and postnatal care. Pregnant women come in to see us, they come in with a lot of different problems relative to the course of the shifting and the weight from the baby, and different discomfort that can occur in both the hips, the low back, the mid back. So the biggest kind of question and fear that comes to mind for most people when it comes to manual therapy, chiropractic, and pregnancy is it's safe. And yes, it's very effective and safe for most problems that we see with pregnancy as it relates to aches and pains and sciatica, etc. How did you find us?
Okay, so just a little bit of background. Yes, definitely the bundle of joy turned into a little bit of pressure in your back and sciatica pain, and it just turns into like a little bit of manageable toward the end for me. I was doing prenatal, but I realized that wasn't enough. So I talked to my doctor, because someone in the past told me that they used a chiropractor, and she said it was safe. Then I just search chiropractors in my network for my health insurance. You came with your practice came up at the top with good reviews, so that's how I found you guys. Okay,
so usually that can be the conversation that happens with your OB. I'm having some discomfort, right, and I know that chiropractic has been helpful, or have you tried this, have you tried that? So the nice thing about what we do here, in my opinion, is that we combine physical therapy and rehab, dry needling in a lot of cases, as well as chiropractic care, all in the same visit. So Margarita's experiencing that last time she came in, and she's far enough along where I'm not going to throw too much at her. That would be, she's very active in her own right. I gave her some lower back and some core exercises that she can continue to do to keep things moving in the positive direction and moving just in general. As well as we do dry needling on her low back and her hips when she comes in to help out with some of the stiffness, the pain, some of the myofascial discomfort that she gets on her lower back. And then her OB referred us over to see us. And there's something that OBs sometimes look for with chiropractors, whether they're Webster certified. That's a common term thrown out there. And that's just another continuing education you can get as a manual practitioner. Massage therapists can get it, physical therapists can get it, chiropractors can. And it's an emphasis a little bit more on the round ligament and the pelvis in general as it relates to mobility and balance. Certain soft tissue approaches to treating those tissues. So I'm going to show you that, as well as some other things that I've picked up along the way in my education, as well as in some different techniques to help out with Margarita's low back discomfort, and how I treat most pregnant women that come in to see me in the office. So thank you for allowing us to do this, because I know that's definitely a little bit of a question for people related to just body work in general and what's acceptable. In the state of Maryland, we can also use massage therapy in the second and third trimester, and we have a massage therapist here, and who I want you to actually see, Jess. She worked in a clinic that was specifically for prenatal for a while. I think it would be a nice addition to what we're doing in here. Okay, so scooch forward a little bit, let your feet kind of feel grounded on the ground, if you will. And we're going to do some simple movement into flexion while I do some soft tissue work on your low back into your sacrum, okay? So this is a nice one that I do with a lot of women, especially later on, because the baby drops low and there's so much pressure that exists lower in the pelvis, and it's something that your partner can help you with at home in terms of getting some relief on your own, okay? So usually I kind of educate, and Spinning Babies is a nice website to learn about some of those techniques. So let's go ahead and just bring the knees a little bit wider. You're going to go down, bring your chest down towards your knees. I'm going to kind of lock your sacrum to the table, and then you're going to find that stretch for you wherever you're at right now, okay? I've been working with Margarita over the last month and a half. Would that be right? Yeah. No, just a month. You came in, I'm going to try to remember this off about a month ago exactly, early September, and so I've gotten to know kind of what works well with her, what she responds well to. She responds well to soft tissue work and flexion, as well as some work on the hips. So I'm working on the mobility of the spine in this position. You can come back up when you're ready, kind of reset, let yourself breathe a moment. We're going to keep the treatment, relatively speaking, kind of a little maybe lighter than we've done in the past, just because you had such an intense night last night with some contractions. So just let me know if anything is kind of too much pressure or too much work today, okay?
Okay, feels really good.
And then come back up nice and slow. And then scoot your hips back a little so you can feel a little bit more supported. Good. Same motion, okay? And I'm going to assist you a little bit here, okay?
Okay.
slow. And then slowly go forward. So I'm grateful to say that my wife has been through 2 pregnancies and we're on our 3rd right now, and she just finished her 1st trimester. And I think maybe she's the passionate relative to wanting to learn more and more about how to help out with women that are going through pregnancy, and getting to work with her over the past couple of years doing that has been awesome. It's a really nice way to connect. And so I kind of educate and try to share that with, just so that it's kind of a joint effort, if you will, going through this, the first 9 months where it can feel very one-sided sometimes. Deep breath in, use your arms, pull your chest down just nice and slow when you're ready, okay?
Okay.
You can take a little break, yeah. So a lot of times where she's going to say that it feels a lot better is when I get below the ilium here onto the sacrum, and when I hook onto the sacrum itself and just hang out there for a little bit. Don't slide off, hang your pressure down, hang my pressure more basically towards the floor, and I create a little hook to pull that sacrum into a little bit of counter nutation, and it really takes some pressure off of her lower back. Feels wonderful. And then take your time coming up for me, okay?
Okay.
You doing okay with that?
Oh yes,
Alright.
I'm really good.
I'm gonna lift this up just a little, okay? So the soft tissue work on the rowel ligament is very gentle, with just a little bit of compression and over the tissue itself. So there's different myofascial components to working on the belly. I can feel the obliques. What you just saw me doing was kind of pulling through the QL muscle in the back and hooking into the side of her low back into some of the deeper muscles, and kind of keeping my fingers present and finding a little lift in there. So finding some pressure in the deeper muscles of the lumbar spine. But on the front, it's much more gentle. Everything's much more superficial. And obviously there's some important cargo below where you don't need to be forceful, right? With a round ligament, it's a little bit more vertically in the front. And this technique kind of argues that you can create a little bit of a stimulus and a reflex in that tissue to let go. So if you have tight round ligaments, you'll know that if you can get that to let go, it's a blessing. And when you really get somebody, she doesn't have this, right? Her pressure and her tension, she sits more in her low back, especially in this right hip today. But when you can get that worked on, it's lovely. It really helps, take some pressure off, take some of that shooting discomfort that you can get. You can only control things so much as it relates to where the baby's sitting, where the baby's resting, where the pressure is occurring from that standpoint. So you have to know that there's a certain kind of maximum result you're going to get. But that's my goal, is getting close as possible to that maximum result and giving her body some relief to some of these pressures and aches and pains from a spinal standpoint and a muscle standpoint. So hopefully that gives you a little connection if you're looking for that. And if you're not, you could have fast forwarded all that for you. So from that angle it's hard to see, but I'm just above the pubic symphysis, a little bit lateral, getting a little action from the baby.
Yeah, he's saying hi.
Hey, what's up? So your daughter, is she excited?
Oh my God, she's like, the other day she heard me breathing and she's like, Mommy, why are you breathing so quick? You having contractions? We're ready to go. She just can't wait.
She's
just
ready.
like, okay, when is baby coming? I want him to come now. Like, give him 1 more week until he's full term. He needs to be there for 1 more week.
Yeah, you're close.
I'm getting close, yeah.
Which for you is you're really close, because were you on time with her a little early?
With my daughter, I had to induce.
But they're checking with you a
But
little
with
bit
this
more.
little one, I think he wants to come out sooner rather than later. My daughter, I think she wanted to stay there longer. I definitely felt some pressure in my, and yeah, in all of that area last night, like in my ligaments, my family ligaments.
Yeah, this late on too, you're gonna find when the baby shifts down too, it's just
Mhm.
the pubic symphysis is gonna get that pressure, so
Yeah.
you'll feel lower discomfort. There's
Oh,
no
yeah.
doubt. When you start to feel it kind of shift from one side to the other, that's something that sometimes I can kind of take and help out a little bit with, right? Pubic symphysis pain is, my wife had it on her first, with Scarlett, our first, and I actually recommended that she get a little bit of a supportive brace, something that sat a little lower, because there's some good evidence to support that for pubic symphysis discomfort.
I have one, and I only use it when I'm working out,
Okay.
but because it makes me uncomfortable sometimes, but I should probably start using it, on a regular basis.
Yeah, the nice thing about the braces is you get to wear it, and if it gives you a little less discomfort, that's good, right? It's a little bit of a trial and error type of thing, but most of the time with that lower deep discomfort there, it can be helpful. So you're gonna feel a little stretch to the hip, easy, and you'll feel a little release in your hip here, okay?
Okay, that's good.
Good.
Oh yeah.
Good, and let it fall. Good. Here's your hip, let it go. There you go. It's a little light psoas release, a little light round ligament work on this right hand side. And I'm going to show you how I adjust her mid-back in a really comfortable way. I can have her lay face down, which I will, but I'm going to show you a different way to adjust her back. You can't go into labor right now. Okay?
No, I know.
You gotta wait.
I'm good.
Take
Besides, I think he likes doing it at night.
Is that right?
Yeah.
That's when it actually comes?
Yeah, that's when he actually tries to. Is it good?
Almost. You just rest your chest down. Good, there you go. And I kind of get lazy here for just a moment. There you go. Take a deep breath in. And let it all settle. There you go. Now you can drop down. Loose, loose, loose. Good.
Oh, good.
Probably doesn't help things out, but from a timing standpoint, all the things that happen and cascade forward for the delivery to ensue, it'll naturally happen.
Yeah.
But there's certain things you can definitely do to stay relaxed during that time. And we kind of talked about a lot of those, and I think this is a nice additional way to do it.
Oh, so good.
She definitely has some stiffness in her sacrum. I don't think I need to side posture her tonight. There's a technique where this table lifts, it drops like this. It's louder than it actually is. That's what you're going to be feeling and hearing, okay?
Yeah.
You're going to get a little more stretch this time, okay?
Sounds good.
And breathe in and exhale. Good. All right, table's gonna come on up. And last, we're gonna work on your shoulders and your neck a little bit, okay? You can lie on your back for me. Take your time getting there. At times, we can do the side posture adjustment where she's lying on her side and there's a little bit more of a release. But as I'm working with her, she just is moving so well in her low back. She doesn't need all that motion right now. But it's a safe adjustment for her in her lower back where she'll get certain results with that. And she has in the past. Let it all settle here. Oh, Margarita. How are you?
Oh, that felt so good. Could do that for 1 more hour.
There it is. Hey, I'm so grateful to get to work with you, and I appreciate you doing the videos.
Of
It's kind of you.
course.
I hope it inspires people to get some work done during the pregnancy. You deserve it. Get body work done by someone that knows where they're going, what they're doing, helping you out, giving you good instructions both at home as well as an experience in the office. And if you're in Baltimore and you need some help, I'm happy to do so. Thank you for taking the time with us, and thanks for watching.
Thank